Hello, my name is Dr. Paul Scheiwiller. I'm an anesthesiologist at the Institute of Orthopedic Surgery. I want to talk to you a little bit today about a brachial plexus nerve block. This block is designed to block your arm, elbow, and hand. It is a single shot and is designed for your postoperative pain management. Before we get started, I want to introduce you to the anesthesia team. You will maybe have already met or soon will meet an SBA. An SBA is a special block assistant. She will be positioning, prepping, and assisting in the procedure. Her duties also include monitoring you before, during, after the block, and providing for your comfort. You will meet an anesthesia provider. This will likely be a nurse anesthetist or another anesthesiologist. This person will take you to the operating room and provide you with your anesthesia care. Your comfort and safety are very important to us. The procedure has been designed to maximize both. The nerves to the arm, hand, and elbow are located in the shoulder, upper lower neck region. This is where the block is performed as indicated by the arrow. This is a very simple procedure. It will take less than 5 minutes to complete, and the block will last approximately 12 to 24 hours. You will be positioned on your side for the procedure initially. The bed will then be raised. We're going to ask you to let your arm relax and just let your neck and head relax on the bed also, as indicated by the arrow and the picture. The area will be prepped. The prep solution is quite cold and is colored orange. An ultrasound probe will be placed over the nerves. The ultrasound machine allows us to look underneath the skin and see the nerves. This is extremely helpful. We'll then use a very small needle, about the size that an insulin injection would be given by a diabetic, and we'll numb up your skin. Then a special block needle is placed through the numb skin and is directed to the proper location. Once we are satisfied we are in the proper location, medication is injected. We watch the medication surround the nerves. Once we're satisfied that it has done so appropriately, we remove the needle and then we're done. The area of numbness is essentially the entire arm and hand. It's a very, very complete and dense block. Generally speaking, there is sparing in the armpit area as demonstrated on the picture and as the arrow indicates. What is up with my arm, people ask. You initially will notice warmth, and then you will notice that your arm will feel extremely heavy. You will feel as if you do not have an arm. If all goes well, you will wake up and your arm will not even feel as if it is yours. This is of course temporary and lasts 12 to 24 hours. Side effects are not common with this block. However, if they occur, they would last 12 to 24 hours. You may notice warmth on the side of your face. Your eye may become bloodshot and droopy. Your nose may become stuffy. Your voice may become hoarse. There is a big long nerve that goes to the diaphragm that sometimes gets a little sleepy, and you may notice some shortness of breath. If you do notice this, we suggest that you just sit up. By sitting up, it lets the diaphragm fall, gives more room for your lungs to expand up and down, and generally you notice very significant relief from that. Please be very careful with your numb arm. Protect your blocked extremity from excessive heat, sharp objects, hard or pointed surfaces, and unless directed otherwise, please keep your arm in the sling. Consider using a pillow or perhaps a wadded up pillow or blanket or even a towel to protect your arm. Think of your arm as a newborn baby, and please don't lean against, as if it was a newborn baby, don't lean against your arm or placing the baby on a hard surface or anything that would be sharp or pointy. In addition to the postoperative benefits, you also have benefits that include less anesthesia and less pain medication giving during your operation. Generally, you wake up quicker with less nausea and vomiting because of the above. You generally can get home faster or out of the recovery room area faster. You many times have significantly less pain postoperatively. Remember to use your pain medications wisely. start your pain medications prior to the block resolving. You will receive specific recommendations at discharge. Anytime we place a needle in anybody for any reason at all, there is a slight amount of risk to this. This includes damage to surrounding structures, as well as risk of medication reaction. But this is why we use an ultrasound machine, special needles, we move you into a special block area, and we use special injection techniques. We will monitor you both during and after the block. A few important housekeeping items. Your guests will be asked to exit the room during the block. We will be bringing in our equipment, which includes an ultrasound machine and several trays of materials. You will be hooked up to monitors, EKG, finger clip, and blood pressure cuff. We understand if you're nervous, it's not a problem. We're going to take great care of you. I saved the best for last, and that is the nurse will provide you with sedation. This is roughly equal to 2 drinks. We like to think of margaritas. This is given to you before your procedure through an established IV. There will be plenty of time for questions. I appreciate your attention. I'll be visiting with you shortly. Thank you.